So, good evening, everyone. So, myself, Tamari Silvan, lecturer of physiotherapy from CRC Davanagare, under administrative control of NIPID, National Institute for the Empowerment of Persons with Intellectual Disabilities, Secunderabad. So, I welcome you all for this wonderful event, webinar on nutrition management and feeding techniques for children with disabilities. So, thank you for taking time out and being here today. And let me just introduce about the objectives of this webinar. Today's main objective of today's webinar is the nutritional management. As you all know that the nutrition is very important for a healthy life. So today we are going to focus more on the nutritional management and the feeding techniques for the children with the disabilities. So how to give a balanced diet and what to feed and how to feed. So this is the main objective of this today's webinar. And for that, we have two eminent speakers. And let me introduce the first speaker of today's webinar, Srimati Bhuvaneswari ma'am. Ma'am is a clinical dietitian at Suchiroyo Hospital, Hubballi, Karnataka. And ma'am, she did a master's in nutrition and dietetics from Satya Sai University. Ma'am has 18 years of clinical experience, and she is a registered dietitian in Indian Dietetics Association. And madam is her expertise in the critical care nutrition and enteral nutrition and the multi-specialty nutrition aspect. And madam has been a resource person for the various national level workshops in India. So I welcome Srimati Bhuvaneswari ma'am to deliver a lecture on nutritional management for people, children with disabilities. Okay, ma'am. Now it's over to ma'am. Over to you, ma'am. Thank you.
Good afternoon, everybody. I'll start sharing my screen now. Once again, good afternoon. I'll be just speaking about nutritional management and feeding techniques, or I can say feeding tips for children with disabilities. To begin with, we have to understand whether can we call a disabled person healthy? Can we generally say that I'm healthy? No, we can't say that. Having a disability does not mean a person is not healthy or that he or she cannot be healthy. Being healthy means the same thing for all of us. Getting and staying well so we can lead full lives and active lives. That means having the tools and information to make healthy choices, knowing how to prevent illnesses. The contents of this webinar would be a better understanding of the complexity of nutrition for children with special needs, talk about how their needs differ and influencing factors such as medication, physical disability, behavioral issues, how these affect the nutrition, and some tips on how to improve your child's diet, and discuss some of the current diets for special children. Now, next. Why is nutrition such a concern? When children have altered nutritional needs due to disability, they have physical problems, and this leads to behavioral issues. And again, it's a vicious cycle. It goes on. Okay, this will lead to malnutrition, dysphagia, swallowing difficulty, oral motor coordination, and aspiration risk, malnutrition, undernutrition, nutrient deficiencies, and all these together, it will have stressful meal timings and prolonged feeding for all children. And children during this time lose appetite. And I have given some certain conditions wherein normally the feeding problems are seen. There are, I'm sure there will be many other conditions, but I have listed down a few. Next, improper nutrition, it leads to malnutrition, undernutrition. Malnutrition and nutrition are two different things. Growth retardation, moderate to severe motor impairments, improper brain growth development, impaired cognition, cardiac function, lowered immunity, lowered healing ability, micronutrient deficiencies. Feeding problems we most disabled children or children with special needs face would be trouble accepting and swallowing different food textures. They might not like certain hardness in the food, or they might not like raw foods. They might not like bigger size foods. They might throw tantrums at meal times. They might refuse to eat certain food groups. They don't want to eat vegetables. They don't want to eat something which is white in color. They don't want to eat something which is red in color. Something they'll be having special likes and dislikes. Refusing to eat any solids or liquids. So this is a very important aspect here. They refuse to eat anything which is solid in nature. Like they don't want to put the effort itself. They want to stick on to liquids only. They might develop choking, gagging because they keep the food for a longer time in their mouth. Vomiting might be there. Oral motor sensory problems, in severe cases where nutrition is too much suppressed, when the child is not taking proper nutrition, NG tubes and gastrostomy tubes can be placed. That is a further thing. There are some disorders also due to which the child is not able to eat. It's not his psychological or behavioral problem. It will be sometimes gastroesophageal reflex disease, gastrointestinal motility disorders, palate defects, failure to thrive, prematurity, oral motor dysfunction, dysfunctional swallow, dysfunctional in swallowing, dysphagia, esophagitis, then gastritis, duodenitis, food allergies, delayed exposure to a variety of food. Sometimes parents become extra protective and they prevent them from trying a different kind of foods. Okay, and sometimes there will be behavioral management issues also. Short gut syndrome can also be observed. Okay, now we'll discuss the nutritional problems which the disabled can face. One would be underweight and the other would be overweight. Underweight, what would happen underweight? Commonly known as failure to thrive, where we see the child is not able to thrive well. The child is not able to grow, is not able to achieve the stepping stones. And this can be due to a number of reasons. Many diseases have higher than normal calorie requirement. For example, some of the conditions make the children too hyperactive. They might be spending more energy. They might be expending more energy than is required. Malabsorption. Certain conditions lead to malabsorption of the nutrients. The nutrients are not absorbed properly, and that can lead to various kind of underweight issues. The poor ability to eat. They might not be able to have the energy or the strength to eat. Behavioral issues can be there. Okay, why this is a cause for concern? This is a cause for concern because when enough calories are not there for growth and development, the child is not able to achieve the ideal weight. Especially here in disabled children, we usually consider the weight here. The child is not able to achieve the ideal weight. Next, coming to the micronutrient deficiencies causing other comorbidities. Micronutrient deficiency like anemia, B complex deficiency, and multimineral deficiency can occur. It can affect behavior, mood, and bodily functions also. Next, the next problem would be overweight and obesity. A brief study conducted in 2010 amongst 12 to 18-year-old children with physical and intellectual abilities, it was seen that most of the autistic children, that is 67% of the autistic children, are overweight. 86.2% with Downs are either overweight or obese. 18.8% with cerebral palsy were either overweight or obese. 83.1% with spina bifida were either overweight or obese. 39.6% with intellectual disability were either overweight or obese. So you can see that overweight and obesity is a very is a common problem amongst the disability as well as disabled children as well as among normal individuals also. Next, coming to the reasons for obesity. Why the children get obese? The high price of healthy foods compared to unhealthy foods. A packet of Maggi costs much less than making 2 or 3 chapatis, and it's easier to make. So again, parents would prefer giving unhealthy food to a child because they don't have time to make it, or they don't. Sometimes children don't like it. Increased portion sizes, the child might want to eat more than what he is burning actually. Then the increased availability of processed food. As I was talking about a packet of noodles, a packet of instant noodles, the child will prefer that because they're quite addictive. Processed foods are quite addictive and children prefer processed food, chocolate, sugary drinks, increased consumption of sugary sweetened drinks, Coca-Cola, Thums, all these, the various sweetened carbonated drinks the child might like to have. So that could lead to overweight and obesity. Decreased physical activity. Yes, disability has its own problems. The child may not be able to be as active as possibly. It might not be able to burn the calories. Increased screen time. This is a burning problem. Increased screen time, increased mobile times, increased phone, increased TV. All these things make the child totally sedentary, extra sedentary, and it leads to overweight and obesity. The child enjoys food. This concept parents have. The child enjoys food. He or she wants to be pampered and kept quiet all the time, and parents will just give him or her the unhealthy processed food because the child likes it and they want the child to be happy. Reasons for obesity not related to food, like we'll also discuss uh, some aspects. See, always obesity cannot be related to food itself. So we'll see that child has a poor relationship with food. Why he is not eating? He has a behavioral issue and that has to be corrected. Then barriers to exercise. The child can't exercise due to so many other physical problems. Medication. 75% of all children with special needs are on medication. Some are associated with weight gain also. Then family stress, hectic schedules, less time to cook proper meals, financial burdens. Then coming to genetic disorders. Genetic disorders also predispose the children to obesity and overweight. Perceived risk. The parents don't want the kids to get hurt. More pampering is there. The children want them to stay at one place. They don't want to because they're already in difficulty. They don't want further. The parents are extra protective in this case. The parents stop them. As the study says, the parents have stopped them from doing what they want because they are scared that the child might get hurt. Then social isolation. Due to social isolation, they have fewer friends and they don't have a greater activity. They don't exercise much. They don't walk around much. They don't go around much. They're not active at all. They're excluded from team sports due to physical issues. Again, coming to screen time here. The screen time is a major problem. Most parents are allowing their children to use mobile tabs and etc. As a diversion, and sometimes we can't even blame parents also because the parents are overstressed and the mobile or the tab or the laptop acts as the babysitter. Next, concerns for obesity in special needs. Why obesity is a problem? Because it makes movement more difficult, reduces child's ability to participate. It's added stigma for the child who are already stigmatized due to their disability. It is more difficult for caretakers to help with daily tasks like bathing, toileting. It increases the risk of secondary health problems like type 2 diabetes, asthma, cardiovascular diseases, sleep apnea, some kind of cancers, stroke, arthritis, and gynecological problems. So, obesity can also incur additional health care costs because due to obesity, the overall treatment becomes further expensive. Tips for parents to maintain healthy weight. You have to start early. Preventing unhealthy weight is easier than losing it. Yes, we all know this. So we have to start early. The moment we realize our child is not burning enough calories or is not burning enough energy, we should make it a point to change that habit, because bad habits can be hard to break. Make a change as a family. Whole family benefits from a healthy diet. Yes, the diet does not apply to one person or one individual. It applies to whole family. The limits on screen time and sweets, regular exercise, it includes everybody, because as a family, it has a lot of impact on the disabled children to follow a new schedule or a new system. Portion sizes, use proper portion sizes, no extra foods or settings. You have to restrict yourself no matter what the child says, I want to eat more, but you have to look into the obesity aspect of that, or weight aspect of that. Next, start small. Just start one thing at a time. You can't suddenly make a change in the diet and ask the child to follow. You can't just start a diet suddenly. You have to wait and do the change slowly. 3 days later, you can do the another change, because the disabled children are very sensitive for any change. They might not like the changes. Mindful eating. Kids overeat if not being mindful. No eating in front of the TV. Eat slowly. This should be taught to the children as early as possible. Encourage child to have their own health and fitness goals and celebrate when he or she meets them. Achievable goals might include eating vegetable and fruit every day, or walking or exercising every day as suggested. Next, next problem is malnutrition. Malnutrition affects every aspect of life. Malnutrition, it interacts throughout pregnancy, infancy, childhood, adolescent, adulthood, old age, and leads to disability. And in disability, what happens is the nutrient need increases, the nutrient loss also increases, but the nutrient intake is less. So what happens is you have to supplement it with micronutrients, macronutrients, and check for the anti-nutrients which inhibit the absorption of micronutrients and macronutrients. Next, disability increases the risk of nutritional deficiency, especially in conditions like cerebral palsy, cleft palate, or cleft lip, where the child can't eat well. Genetic disorders such as Down syndrome. The risk of developing a nutritional deficiency is quite high, because it's associated with oral motor feeding and swallowing problems, leading to malnutrition. Nutritional needs. Nutrients are required for body functions, energy, good health, growth and development in children. Need a balance of both macronutrients and micronutrients. Macronutrients are your carbohydrates, proteins, and fats. Micronutrients are your vitamins, minerals, trace elements, fibers, and water. Okay, macronutrients. Macronutrients are the bigger nutrients. The example would be that would be carbohydrates, proteins, and carbohydrates. All carbohydrates break down into glucose molecule. This glucose molecule, the carbohydrates, if you eat more of sweets, more of carbohydrates, there is a mood elevation. The mood elevates, but you can't give just the sweetened food to the child. There should be a variety of complex carbohydrates, because carbohydrates also contain vitamins and minerals. Next, coming to protein. Yes, we all know protein is important for muscle building and growth. It is required for the immune system, healthy immune system. So protein is very much important unless it is restricted by a medical condition. Proteins are required for the hormone and the enzymes. It's very important, yes, especially in the disabled children, that hormones and enzymes are efficient in their functioning. Proteins act as transporters, help in skin repair. Sometimes the medicines which the child is taking can increase the protein needs. So protein is something which has to be dealt with carefully, and it has to be supplemented well. Some illnesses can also cause an increase in the demand of proteins. Next, coming to fat. Fat for energy and brain development. Why is fat required? We might always see fat as the villain. You might see the child might, there will be some overprotective parents also who think that my child is overweight, I should not give him fat and restrict the fat totally. No, fat has its own role, because it is required in eye development. Minimum amount of fat is required for the child. Skin and hair growth, insulation, body temperature, to maintain the body temperature. It acts as the insulation for the internal organs. Fat soluble vitamins are there in the fats, that is A, D, K, E. Then omega-3 fats, which are good fats. Fat also improve the mood balance, they're anti-inflammatory. They reduce the inflammation in the body. Next, coming to the micronutrients. Micronutrients are your vitamins and minerals, fiber, and water. Vitamins and minerals would be for growth. Yes, B vitamin, very important. It's very important for brain function and mood. Calcium, the B vitamins and other micronutrient deficiency can lead to a lot of health problems. So supplementation, I would suggest supplementation is very important. You should be asking your physician for the micronutrients supplementation. Next, calcium, vitamin D, magnesium, phosphorus required for healthy bone and teeth. The skin repair, vitamin A, selenium, zinc, vitamin C. Development of iron, the hemoglobin, iron, folate, B vitamins. They all require for oxygen carrying. Then iodine. Iodine is very important. Thyroid function. So I would suggest all of you to use the normal salt, the iodized salt, not any special kind of salt. Okay. Then fiber for a good intestinal health. Why fiber is required? What kind of fiber is required? Yes, there are two types of fiber, that is soluble and insoluble. I'm talking here more of soluble fiber. It helps relieve constipation. Yes, because it absorbs water and makes the stool softer, and it relieves constipation. Fiber is very much required in our diet. It's usually found in fruits and vegetables. It keeps bowels regular. It improves digestion, aids in developing good bacteria. Next, water for life. Why water is required? Sometimes the children may not drink enough water due to so many reasons. What happens if water is not sufficient? Dehydration, it impairs every bodily function. It reduces the concentration, memory. It alters mood and behavior. Dehydration leads to confusion and slow reaction, lethargic, no energy, decreases athletic performance, impairs heart function and all organ systems, adds to stress. As I said, most children are not drinking enough water, so sufficient water should be given unless indicated otherwise. There are some conditions where water is restricted. That is a different condition, but generally water must be sufficient, and our body is almost 60% of water. Next, next to the nutritional planning. Okay, so as you can see towards this, there is a my plate. My plate, it contains everything. You can just see fruits, vegetables, grains, fruits, and dairy. So all these things should be there in the diet. Nutritional planning, which is very important to know your child's needs. What are your child's needs? What is your activity level? That is very important. It can be different on the child. So it is not actually having same kind of needs. And the diet must be individualized. So I can't give a general diet for anybody, right? I can't say that this is the general diet should be followed by disabled children. No, because each diet must be individualized depending on the energy requirement, any special needs, nutrients, proteins, because some conditions like cystic fibrosis, fat soluble vitamins, pancreatic enzymes, may require extra calories, and so it's very important that the special needs are noted down. Autism, increased B complex vitamins, complex carbohydrate, protein should be there. It's important in skin repair, especially supplementation of zinc, vitamin A, vitamin C, and iron is mostly required in autism. Then coming to cerebral palsy, spastic movement, increased energy and protein, because the movement is quite high, so the requirement is high. So again, it varies from child to child. Then child to child, and it is different for every disability or the syndrome. Next, activity level, depends on the activity level. Mechanical issues, which we'll be discussing. Then behavioral issues. Behavioral issues. What kind of behavioral issues we usually come across? Picky eating behavior, eating preferences. They don't want certain foods. Difficulty with transition to appropriate age diets. Like at particular age, they're supposed to eat solids. They're not eating. They refuse to eat. These are the problems faced by the caregivers. So what can be done? I'll just tell you the coming forth slides. Increase sensory sensitivities. They're more sensitive to smell, temperature, light. You can't be giving them strong smelling foods. Short attention span, limited variety to diet, stick to safe and familiar foods, need for a routine, eat at a certain pace and a time. Next, mechanical feeding issues, choking, gagging when feeding, having chronic respiratory problems, excessive spitting or vomiting, requiring a long time to feed, and an infant might become exhausted or excessively sweaty when feeding, eating small amount during feedings, having a proper appetite or not indicating when they are hungry, not progressing to baby foods, finger foods, stable foods at expected ages, still they want only liquids. That's not acceptable. Poor growth. Next, coming to the feeding tips for parents and caregivers. Meal time mode. The meal time mode is very important for the child. You should provide a quiet atmosphere, no television. Music can be used. You can use soft music. Wash your hands and wash your hands in child's face and hand before the meal. Announce it is time to eat. Every day follow the same time. Just don't allow the child to eat whenever he or she wants. Seat your child in a comfortable position. The child should be seated in upright position with hips and feet at a 90-degree angle. No slouching or feet dangling off the chair. No slouching from side to side. Use belt in high chair or pillows on sides if necessary. If your child cannot sit upright in a chair or infant seat, pillows or use pillows or towels roll up to prop up the child, which I think most of you will be doing that. Share positive emotions. Don't show your frustrations when you're feeding with a child. Give lot of praise when the child achieves a milestone. Next is be using the right equipment. Spoon size should match the size of the child's mouth. Coated spoons are great for infants or children who bite down hard onto a spoon. Sectioned plates or small bowls with a lip on the sides to help self feeders. Sporks, a combination of fork and spoon, are helpful. Sippy cups or mugs with handles for self feeders. These should be using the right equipment so that feeding is more comfortable. Choose foods wisely. Start the meal by massaging your child's gum with a finger dipped in lemonade. Lemonade is your lemon juice. This will get your child sucking. Having your child lick or suck on popsicle will work. Popsicle or something to what we call a sugary sweet, lemony sweet can be given so that there is a salivation in the mouth and the child starts sucking. This is for smaller children. Keep hot foods hot and cold foods cold. If a child can self feed, provide foods such as cut up hard cooked eggs, cut up fruits, folded chapati roll, small sandwiches, and also serve liquids in mugs with handles so that they can self feed. They'll be more confident and self dependent that way. Okay, and straws should be used only when they're able to. Unnecessarily, don't introduce straws at a very early stage. Better to sip from a mug. Use the sips of fluids like rasam or gravy between solids. Thicken fluids if needed. Pureed food should be thick enough so that it does not spill out of the child's mouth up, and the consistency should be about a mashed potato, like how you make the mashed potato for pav bhaji or potato bhaji, watery, slightly pureed kind. Okay. Then add ground meat, what we call keema, in your child's diet as teeth come in or see your child's chewing motions. Add calories or proteins, but not volume. See, this is very important aspect here. Like for example, the child is eating one bowl of rice. How you can further improve, how you can further improve the nutritional quality of that particular rice. For example, you can add ghee, butter, curds so that the total amount of calories increased. Add butter, ghee to vegetable dals, curries. Add dal paste to chapati dough or pulses to dal while cooking so that you don't have to add it separately. Okay, non-veg food can be given to the child when the child is able to chew well, like keema, chicken pieces totally chopped to small pieces and cooked well. Uncooked food should not be given at all. Especially, you can give the child when he is able to chew well and swallow well, but uncooked food would not be recommended. Next, feeding tips for parents and caregivers. As I told you, create a supportive mealtime, limit distractions, offer foods that are more difficult or new when a child is most alert. Don't force them every day for a newer experiment. Okay, so that means when they're more alert, when they're more interested, you will come to know your child's more. That time you introduce newer foods. Eat meals together as a family. Be a role model. You can't say, I don't like this in front of your child because your child will pick up the same thing from you. Be patient. Never force feed or trick your child. Cheating your child that this is that, this is this. So sometimes we do that. So if the child doesn't like paneer or something, we just trick it and we just try to hide it and give it. But once the child realizes that you're cheating him, he might lose trust on you. So he might not try something new at all. So never force feed or trick your child to eat. Yes. Now we'll be discussing the current diets. Uh, Gluten-free diet, casein-free, vegan gold, ketogenic, simple carbohydrate diet, then yeast-free, sugar-free, and various dietary supplements like omega-3 oils and vitamins. Next, now coming to the first aspect. Coming to the first aspect, gluten-free, casein-free diet. What is gluten? A mixture of two proteins, gliadin and glutenin, that give flour a cohesive, elastic property, turn into dough. Some children are gluten sensitive. It is mostly present in wheat, barley, rye. Oats, it's there up to 20%, something less than 20%. What is casein? Some children are allergic to casein, which is there in milk and milk products. Primary protein found in mammalian dairy sources. Several variants according to order or species. Okay, present in milk and cheese and yogurt. So what was done? The theory behind this gluten-free, casein-free, or can say lactose-free also at times, is leaky gut syndrome. This is what happens is the casein and gluten, they just leak across the intestinal wall and enter the spinal fluid, and they act like opiates. And these opiates, they affect the CNS behavior, especially, and resulting in autism. So this is just a theory. Okay, it might not be applicable to everybody. So this kind of diet is also used in treating children with autism. So there is a restriction of gluten and casein. It is not universally successful. Results suggest that younger and more severely affected children were best responders. Only in severe cases this was used. Otherwise, the child was given to eat everything. All types of foods were allowed. Only in severe cases this was tried. Parents tend to be more pleased with the results than teachers. Increased risk of nutrient deficiency. Yes, of course. If you restrict wheat is an important carbohydrate. It's a source of B vitamins, and casein is a very good source of calcium. Milk is a very good source of calcium and B complex also. So once you restrict, there's an increased risk of nutrient deficiency. It has to be corrected by supplementation. Next, coming to wheat products are high in B vitamins, iron and zinc. Dairy, calcium, vitamin D, phosphorus, protein, B12. So it's important that this kind of diet is tried only in severe cases. It's very difficult to stick to, especially for picky or selective eaters. Next, coming to Gold diet, it was developed by Dr. Gold in 70s. Link between additives and hyperactivity. Yes, food additives make children uh, overactive or hyperactive. So in this diet, no artificial colors are used, dyes are avoided, sweeteners, preservatives are avoided, no salicylates. But salicylates are found in healthy foods also. They are made by plant to protect themselves. Some people are sensitive to it. So the scientist Dr. Benjamin F. Feingold tried this, but it's not a universal one, but it improved behavior and attention span. This can be usually done. Sweeteners and dyes, colors can be avoided generally also because it causes health issues. Next is your ketogenic diet. You would have heard about ketogenic diet. Okay, to be very frank, the ketogenic diet was first started to treat children with epilepsy. Later on, it was used for so many other reasons. I would not like to discuss it now on this forum. But on this forum, we will discuss the ketogenic diet. How it can be used to control seizures in epilepsy. Then, wherein high fat and protein and minimal carbohydrate is used. As you can see the graph over, you can see the pie chart here. There is more of fat in this, less of carb, and minimum carb and optimal protein is there. Seizure control. Okay, the theory here is glucose tends to cause hyperactivity. Then the mechanism in which this diet works is it sends the body into ketosis, and the body uses ketones for energy and not glucose, because glucose, according to this diet, the theory is glucose causes hyperactivity. It's a very hard to follow diet. It has to be most of the times it has to be followed by specialists, especially in case of epileptic children. The diet needs supplementation with other micronutrients. It can strain the body, especially liver and kidneys. Okay. Next is specific carbohydrate diet, that is SCD diet. The theory is to balance the microbes in the GI tract, heal the gut. In this kind of diet, no sugar, cooking oil, processed foods, starches, no pasta, no wheat, breakfast cereal. Most commercial dairy products are avoided. What is allowed here is beans, eggs, fish, fresh meat, fresh fruits, vegetables, nuts and legumes, small amount of natural honey. It's quite hard to follow and restrictive. Again, supplementation is required. For it is especially required in. Hello. Yeah. Yeah. For treatment, it is usually used in the treatment of Crohn's, ulcerative colitis, IBS, common digestive problems in special needs children. Yeast-free or sugar-free diet, as the name suggests, no dairy products are used. Yeast infections can cause bloating, psychiatric symptoms, and have been found there is an overgrowth of yeast in the GI tract. Yeast-free should have to be sugar-free also, and gluten-free diet also is recommended. Good bacteria and bad bacteria are there in your body, so you have to the theory of this diet is to restrict that. Yeah. Next, coming to the other kind of diets, GAPS diet, more restrictive than the SCD diet. Body ecology diet, probiotics, less sugar. Raw diet, or eating only raw and uncooked foods. This is a very controversial type of diet wherein we don't suggest, but this is what is followed. Okay. Now, whole food diet, more natural diet. Nothing is processed in any way. So next is selective alternate therapy, vitamin B6 and magnesium supplementation, but we have to be aware of the toxicity also. Nothing has been proven effective, but these are the various types of diets used. Then we can consider omega-3 fatty acid supplementation in fish. It is found in fish, walnuts, flax seeds, soybean, canola, flaxseed oils. Flaxseed is commonly available everywhere, so it can be used. It can be given to give the essential omega-3 fatty acids. Why omega-3 fatty acids are required? They inhibit the body's inflammatory response, may reduce childhood asthma, heart disease, rheumatoid arthritis, important in infant brain development. Yes. Why is a dietitian required? Yeah. You need to plan a diet with a dietitian because it clarifies the detail and purpose of the special diets, guide to parents to adapt to diet to the child's needs, reduce anxiety about implementing special diets, suggest acceptable replacement foods, suggest cost-effective ways to adapt the diet, help families make dietary changes that benefit the entire family. It is not advisable to just look up into just Google the information and use it. It's always advisable to ask a expert. Provide resources for locating special foods. Solve the problem. Problem solve lack of response to uncover hidden exposures. Keep current on new food products and sources. More knowledge about the availability, taste, and cooking with special foods. Offer ongoing support and encouragement. Take away message. as uh, as as I told you, there is no particular diet as standard diet for disabled. We have to plan it according to their symptoms. It's better to work with a dietitian to determine what kind of diet would you suggest to your or do you take for your child. So it's better to work in coordination with a dietitian and review the symptoms. All anything can you have to just understand the symptoms after eating what. So how will you know this? Diet history or food journal can be kept. So you have to keep a food journal wherein what the child has eaten after eating, what has happened, what is the change. So this is a food journal or diet history has to be maintained. Summary, keep the food wars away. Medication should be taken with care. Model eating habits, learn appropriate serving sizes, chewing issues, soft food should be given. Read labels, understand sugar, fat, and sodium content. Allow occasional treats. This is very important. Don't restrict so much that the junk food becomes a forbidden fruit. Okay, so you should be allowing some occasional treats also. Offer a variety of foods. It takes many introductions to a food for it to be acceptable. Make sure to always have one food on the table which the child feels comfortable. Don't give new food suddenly. That is what it means. Eating in the dining room or kitchen table. No car snacking, walking around snacks, or watching TV. The child should be made acceptable by involving in planning, shopping, and cooking. Then summary, no drinking, then comes no drinking of sweetened drinks, that is carbonated ones. Choose whole grains. Poaching and roasting is advisable. Grazing, for example, the child comes to the kitchen and eats very often. One demands food. Set the timings when the kitchen is closed. If your child eats out of boredom, redirect him or her to other pleasant activities. It's very important that sometimes children eat out of boredom. That leads to obesity. This would be it. That's all. Thank you.
Uh, thank, thank you so much, ma'am, for your useful and wonderful presentation. And I hope this presentation was useful for the parents as well as the professionals who are working with the children with disabilities. And there is information for all the participants, and there will be a question and answer session at the end of this webinar with both the resource persons. And I request Madam to stay on this webinar to attend all the question and answer session at the end of this webinar. And also, you will get the feedback link at the end of this webinar. I request all the participants to fill the feedback link and to submit it and without fail, so that you will get your e-certificates. Okay, so thank you. Next, we will move to the next topic, feeding techniques for the children with disabilities. And let me introduce about our resource person and my colleague, Shri Neeraj Mishra. Sir is a lecturer of occupational therapy in CRC Davangere, and he formerly worked at GB Bant Hospital, New Delhi as an occupational therapist, and he has 6 national awards in All India Association of Occupational Therapists in his name, and also he has 6 national and international publications in his name also, and he has vast experience, almost 12 years of experience in the field of occupational therapy. So welcome, sir. Welcome, Neeraj Mishra, sir. Now the screen is yours.
Hello. Yeah, thank you so much, Dr. Selvan, for the introduction. A very warm good evening to all of you. So today, after a wonderful lecture by Bhuvneshwari Madam, we will be further discussing about the feeding techniques in children with disabilities. Now, feeding plays a very important role in parent-infant relationship. It is very important that you can adequately feed your child. Otherwise, it is a cause of stress for the parent and it is also a cause of concern for the child which is being fed. Also, the developmental progression of food selectivity is primarily determined by a child's ability to suck, manipulate, chew, and swallow food. So, if you analyze carefully, you will feel that as the child will grow up, he learns various ability, and that will help in his transition from liquid to semi-solid to solid food. And for this, all these abilities need to develop properly. Also, for safe feeding, there is a coordination of sensory motor function, swallowing, and breathing. We will be discussing about this in detail. Generally, children can self-regulate their amount of feeding, and there is a variability of around 30% per day without any ill effects on growth. However, if there is a variability beyond 30%, then it is a cause of concern. Also, caregivers are responsible for what is being fed, when it is being fed, and where it is being fed. At the same time, the children are responsible for how much they will take and whether or not they will eat at all. So, overall, the normal feeding depends on the successful interaction of a child's health, his development, his temperament, experience of a good feeding opportunity between the child and the caregiver, and the environment in which the feeding is being done. So if there is a change in any of this, it is going to affect the feeding issues. Now, feeding in children, we have to remember that during the first few of weeks of life, 2 months, feeding gradually changes from a reflexive to a learned behavior. What this means, a infant which is after his birth to up to almost first 2 months, most of the feeding is a reflexive act. There is no volition involved in it. Later on, as the child system will mature, his feeding capacity and capabilities improve, and slowly with time, it turns into a learned behavior. So a certain amount of care and caution is required when it is at the reflexive stage, and then a certain amount of patience and proper methodology is required when it is at the learned stage. The progression from reflexive to voluntary independent feeding occurs along a developmental continuum involving complex interplay between the child's motor, sensory, cognitive, social, and emotional development, and their mealtime or feeding environment. So, when all things fall in place correctly, this entire transition from reflexive to learned behavior is a normal one. If there is a disruption in this entire cycle somewhere, this entire pattern of transition from reflexive to learned will be hampered. Now, normally there are four key developmental stages in feeding. For the first 6 months, mostly it is exclusive breast or formula feeding. From 6 months to 1 year, it is the first foods that the child tastes apart from the mother's milk. Beyond that, from 1 to 1.5 years, there is an increase in the variety of food that is being given to the child. And mostly from 1.5 years onwards, the child is an independent feeder in the sense that many things can be tried upon to be fed to the child. Now, these stages are the identified key stages of feeding development. And the most important thing to remember is problems can occur either in any of the stage or during transition from one stage to another. So either a child will have problem during breastfeeding itself, or they might have a problem from shifting from a liquid to a solid diet. Now, why proper feeding techniques are needed? Proper feeding techniques are needed because children with developmental delay mostly have certain pathology associated with their feeding patterns. Either they will have a poor sucking pattern, or they have a poor swallowing pattern, or there is a poor ability to breathe between sucking. They might have problems with their chewing ability. There can be a problem about their neck control. There can be a problem with their mouth closure. And there also can be hypersensitivity of the oral structures. So all this can result in some kinds of feeding disorder for kids. Now, for an example, there are certain primitive reflexes, especially in children with cerebral palsy, which if they do not get integrated, will cause difficulty. Primitive reflexes initially are meant for the protection of the child because his system is not matured. But after, let's say, 8 weeks of but 8 weeks after growth. If these things don't get integrate, they start hampering the feeding process. So if the tongue thrust is retained, the problem is that the difficulty would be in moving the food back to the mouth for swallowing. The child will just push out the food. If there is limited range of tongue movement, so there will be problem in moving the food inside the mouth for swallowing. If there is limited range of jaw movements, there will be problem in biting and chewing, limiting the variety of textures. If there is poor lip closure, there will be problem in removing food from the spoon, moving food to the back of the mouth for swallowing. And if the child has a hypersensitive gag reflex is when the back of the tongue is touched by something, the child has a tendency to puke out. So if this reflex remains hypersensitive, the child will have problems in tolerating new taste and textures. Apart from this, postural instability, by which the child cannot control his posture, cannot control his neck or head in a stable position, can lead to difficulty in chewing and swallowing, using of hands to reach and explore foods, and also in bringing hands to the mouth for self-feeding. A very common example is in children with cerebral palsy having ATNR reflex. The moment they bring their hands to the mouth, the neck will turn to the opposite side. So it becomes very difficult to self-feed these children. Second problem could be movement disorders. The child has controlling the jaw movements for biting and chewing. So it becomes very difficult in transition from liquid to a solid food. Also, there is problem in bringing hands to mouth, and the hands might either overshoot or undershoot before the mouth. Sensory responses are again a cause of concern. The children could be hypo or hypersensitive to sensory stimuli. So most of the times they might avoid being touched around the mouth. There are also times when if there is excessive noise during the meal time, the child has a problem in sitting at the table, and again he will avoid feeding. The child may not be very keen on trying out different tastes or textures and may gag and vomit in response to new tastes and textures. Some children are hyposensitive too. So they prefer very strong flavors because bland food will not arouse their sensory systems, and hence they will be discouraged to take bland food. So they require very strong flavors for arousal. At times they will require some peculiar amount of textured food for having a successful feeding experience. So first thing, all of you who are listening to this lecture, I'll request you to try to breathe in while you swallow. Difficult? Now, why it is difficult? Because the nature has built a mechanism by which either you can breathe in, either air can go inside you or food particle can go inside you. When this cannot happen in a rhythmic fashion, it becomes a problem and the food goes into the windpipe. So infants with an organized sucking pattern who can coordinate easily between sucking, swallowing and breathing are generally safe feeders, but most of the times, instead of having a 1:1:1, which means one suck, one swallow, and take a breath in between, or 2:1:1, suck, swallow, breathe coordination, these baby have an immature sucking pattern. So what will they do? They will cluster 3, 4, 5 sucks together, and in the meanwhile, they are holding their breath. So what it does, if the child is having some kind of developmental issues, especially related to some cardiological disorders, he might turn pale while having food. Second problem is once after 3, 4 sucks are taken in continuation and the accumulated amount is swallowed as a bolus, there are more chances that it might go aspirated inside their windpipe. And then there would be followed by a severe rapid recovery breath cycle. So this should be avoided. How to avoid this? A simple way to avoid this is that is called interrupted feeding. So let the child suck twice and remove the bottle. Again, let him suck twice, remove the bottle. So the chances of having 4 or 5 sucks together is minimized. Now, what could be the common symptoms of feeding issues? Normally, it is either quantity of food that is being taken is not appropriate, or the quality and the variety of food that we want to give the child is not being taken. Mostly 40 to 85% premature babies will have symptoms of feeding issues. 20 to 25% of normal babies will have symptoms of feeding issues. There will be a history of repeated coughing and congestion with feeds and recurrent pneumonia. So if a child is having recurrent pneumonia and coughs, may be possible that you are feeding him in a wrong way and the food is getting aspirated to his lungs. That is why it is happening. There could be a behavioral component by which the child will refuse food, will become irritable or anxious during eating because his earlier feeding experience was not good, and somehow now he has taken it as a bad experience and he tries to avoid the feeding process completely. Psychosocial aspect is the caregiver is under stress because the child cannot be fed the amount that he or she wants.
Dear participant, please wait for a few minutes. There is some technical problem at Davangere. We'll be resolving it soon. Please wait.
Okay. Okay. Yeah. Okay. Hello. You can ask me some questions. I'm open for questions now. Rati Rajesh has raised her hand. Miss Rati Rajesh, can you ask your question? Mr. Jai Kiran. The forum is open for questions. Gayatri M. Bhatt.
Madam, can you check in Q&A box, ma'am?
Q&A box, yes.
There's some.
Yeah. Okay. Okay, there is a question from Prahlad Dansana. What are nutritional food? It's a very general topic, sir. Nutritional food can be something which can give you proper nutrition, proper health, proper this one. But again, the nutrition, again, the food which gives you all the essential macronutrients. But there's no one food that gives you everything. So any food that gives you good health is a nutritional food. Any more questions? थर्टी प्लस ईयर मैरिड वुमन को डिसेबिलिटी, शुगर, थायराइड, कैंसर हुआ है, बहुत हमें कैसे डाइट और लाइफस्टाइल की हमें जरूरत है. अगर आपको शुगर है, कैंसर है, शुगर में आपको कार्बोहाइड्रेट कम देना चाहिए. एंड थायराइड में हम लोग थोड़ा सा गोइट्रोजेनिक फूड्स जैसे कि कैबेज, कॉलीफ्लावर को अवॉइड करने के लिए बोलते हैं, वो आप कर सकते हैं. कैंसर में अगर आपका ट्रीटमेंट चालू है तो उसके हिसाब से डाइट प्लानिंग होती है, बट उसके लिए आपको एक डाइटिशियन से बात करना पड़ेगा और अपने कंडीशंस बोलना पड़ेगा. ये क्वेश्चन मेघा जी से है, तो आई होप आई एम ट्राइंग टू मेक माई सेल्फ क्लियर. Yeah, how to prevent the child from having junk food? Sangeeta Redekar is asking this question. See, first of all, what I would like to suggest is for the child, how do you present junk food is important. If you say junk food is something special and something forbidden, the child will like to have it. But once you're already started giving the child, the child is already addicted towards it. You have to make the child understand that this is bad. If the child can't understand, then you have to restrict from giving it and give it only once in a while, or slowly start removing it from the child's diet. Okay. Okay, ma'am, what food should we give a child with cerebral palsy who's unable to eat solid food? Yes. If a child is not, this is asked by Cheryl, the child is not able to eat solid food. So what you can do is you can give liquid diet which is thick enough. Which is thick enough, and you can add ghee to it to increase the calories. You can add dal puree, something like that, and make it more nutrient dense. There are some special child pediatric supplements also which can be added to the gruel, to the porridge, ganji, or pureed foods. So you can give the child pureed foods if he is not able to swallow solid foods. Do awareness about parents and gatekeepers. Yesterday, I read 2-year-old girl died due to choking while eating pomegranate seeds and other corn seeds. Well, Shalaka, what I can suggest here is when you are giving a 2-year-old child such small diameter foods, you should be careful enough. Monitoring is very important. What kind of food is being given, and make the child chew the food well before they swallow it.
Selvan sir, are you connected? Selvan sir. Hello, Selvan sir.
Yeah, no.
Ma'am, you can take the questions, ma'am, in the Q&A box.
Yeah, I think some questions are for the other presenter also.
Okay, okay, ma'am.
They're especially, that's why I'm just waiting.
I think they're
Just
not
see if
able
any
to
more
connect.
questions. Okay.
Selvan sir, can you hear us?
Malnutrition can lead to disability. Asked by Srishaila plus Dambal. Okay, yes, malnutrition can lead to disability if